Brendan, I'm going to tell you about the first cranial nerve, which is the olfactory nerve. It's located above the brainstem, below the frontal lobe, and it functions just for our sense of smell. So a normal response, you'd be able to identify different smells, and an abnormal response is you wouldn't be able to identify the smells.
Hey guys, don't worry about it. It smells fine.
Oh my God, David, that's horrible!
So we're going to be testing the second cranial nerve, which is the optic nerve, and it's located above the brainstem behind the eyes, and its function is to detect light and vision. So what I'm going to have Allie do here is first we're going to test her visual acuity. So we're going to see if she can read what is on that sign back there with her glasses versus off her glasses. So can you read it with your glasses on for me?
Yes, with my glasses it says American Red Cross.
Okay, and without glasses?
A whole bunch of blobs.
Okay, good.
Still can't see it.
So next what we're going to be testing is her pupillary and consensual reflex. So what I'm going to do,
Let me see here.
can you take your glasses off for me? So I'm going to cover half of her face. And we're going to watch to see if her pupil constricts with the light, which it does. And then dilates again without the light. Good. And then we're going to do it again to make sure that the same thing happens on the other eye, which it does.
Okay, now we're going to be testing the third cranial nerve, which is the oculomotor, and this one is in the midbrain and pons, and this moves the eye up, down, and diagonally in. So how we're going to test this one is I'm going to ask Erin to look at just the tip of this thing, and I'm going to have you go up and down, and what we're looking for is symmetry of the eyes, which is very good. And now we're going to do convergence and divergence, so I'm going to bring it in until she tells me she can't see it anymore, and then out until she tells me she can see it.
Right there.
Okay. Very good.
So the response for the oculomotor nerve, cranial nerve number 3, are no convergence, no constriction, no eye tracking, droopy eyes, and diplopia.
Hey, David.
Hey Candace, I had no idea you had a twin. High five.
Hey Maria, guess what we heard the nerve today? What? It's the trochlear nerve. It's nerve number 4. It's located in the inferior colliculus. It moves your eyes down and out. Whoa! 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 Dang, that trochlear nerve. Are you okay?
Yeah.
So the next is the trigeminal nerve, and that is cranial nerve 5. And the sensory innervation is to the face, cheek, and jaw, and the motor innervation is to the muscles of mastication, which is for chewing.
Hi, I'm sensory.
Hi, I'm motor. All right, can you feel this?
Yep.
Can you feel it on both sides?
Uh-huh.
Like here.
Yep.
Okay. Can you feel that?
Yeah?
What's going on here? Can you not chew your gum like that?
No.
Can you like tone down the trigeminal nerve just a little bit, please?
Rude.
Close your jaw. Close your jaw.
No.
Okay, so now we're going to be testing the abducens nerve, which is cranial nerve 6. It's located in the lower level of the pons and the floor of the 4th ventricle, and it's going to innervate the lateral rectus muscles of your eye. So now, just with your eye, follow me. Slide to the left. Slide to the right.
Crisscross! Crisscross!
So now let me talk about the abnormal response of abducens, which is cranial nerve number 6. Abnormal response is eye deviated in, so the patient may turn the head to compensate. Let me test it. Brandon, can you take off your glasses?
Okay, doke.
Okay, and can you read it?
7, upside down triangle. Morgan Freeman. The letter 7.
We'll be testing the facial nerve, cranial nerve 7. This nerve controls muscles of the face. Don't make it hard. How do you feel about failing a PT exam? How do you feel about doing well on a PT exam? How do you feel about PT school in general? An abnormal response of the facial nerve is suggestive of Bell's palsy, which is the inability to close the eyes and to produce tears. Here we're going to test the facial nerve. David, I'd like you to close your eyes and try and smile. I think you may have Bell's palsy, David.
Now we're on cranial nerve 8, which is the vestibular cochlear nerve. It is located in the cochlear and vestibular nuclei in the pons and medulla at the level of the junction. To test it, we'll be looking first at Jenna's balance as well as her hearing. Please stand on the blue foam for me. Great. Now please close your eyes. Great. Now you can sit down for me. Now to test our hearing, we're going to use the tuning forks to test bone and air conduction. Do you want to hear a joke?
Sure.
Why did the mushroom go to the party?
I don't know.
Because he was a fun guy.
I hear that.
Cool. Now we're going to be doing the abnormal response for vestibular cochlear. This is suggested of some balance problems or sensory neural loss. So I'm going to have EJ walk. EJ. Hey, EJ. EJ! EJ!
Huh?
Yeah, I think she's got some problems there.
Alright, cool. So we're going to talk about the glossopharyngeal nerve today. It's cranial nerve number 9. Its main function is to detect taste, its swallowing, and the gag reflex. It's located at the inferior salivatory nucleus as well as the nucleus solitaris, and last but not least the nucleus ambiguus.
Caesar.
Yo, what's up, Brendan? How you been,
Not
man?
much. How about yourself?
Good, dude.
I'm parched, man.
Do you
What's
need
going
some
on?
water? I got some water.
I
here
love
for
some
you.
water. Oh, thank
Cool,
you.
man. Here, man.
Yeah. Cheers.
Cheers, dude. Hey, what's going on, man?
Well, it's a little embarrassing. This never happened before. It happened.
It's a glossopharyngeal, man.
Oh, is it really?
It's the 9th one. It's the 9th cranial nerve.
9th cranial nerve.
Yeah, dude.
Cheers to that.
Cheers to that, man.
Alright, so we're talking about the vagus nerve, and that's nerve number 10. And its location is at the nucleus solitaris ambiguus and at the dorsal motor nucleus of the vagus. And the function is taste of the epiglottis and the pharynx, and the receptors of the aortic arch and sensation of the pharynx and larynx. The test for it is swallow and the gag. And the normal signs are symmetrical picking up of the soft palate, and the abnormal is they can't swallow, they gag, and they have a hoarse voice. Allie, is everything right?
Oh, yeah. Hey, what's up? Oh my God, he's dead!
Hello.
Now we're talking about cranial nerve 11, spinal accessory. Located in nucleus ambiguus and cranial nerve. Innervating to upper trap and SCM. Now we're gonna test it. How do we all feel about PT school?
Hello. So, the abnormal response for the spinal accessory nerve is the inability to use your upper trap and sternocleidomastoid muscles. Okay, everyone, we're gonna play Simon Says. First, touch your toes. Good job. Now, Simon Says, shrug your shoulders. Shrug your shoulders, Caesar.
I can't.
Okay, that's a problem. Simon Says, turn your head to the left. David, just your head.
I can't.
Okay. Oh, shoot.
The hypoglossal nerve, also known as cranial nerve 12. Its location is in the hypoglossal nucleus, and its function is to protrude the tongue. So in order to test it, you just simply have your patient protrude their tongue. And then an abnormal response to this test would be if they protrude their tongue to the right or the left. And normal response would be just going straight out. Without further ado, I give you the hypoglossal nerve 12 test.
Are you ready for the Tongue Olympics?
Let's go, EJ!
Come on, Paul.
Let's go! EJ, come on, girl, you got this!
On the count of 3. Are you ready? Set. 3.
Protrude that tongue, people. Let's go.
Let's see the tongue protrude.
You doing it, EJ? You doing it?
Oh, I think we got a normal response over here. I'm not EJ. Oh, goodness. Paul's taking the lead with his tongue right out in front. Whoa, wait.
Got it.
Right behind her. Oh, my God. Oh, my God.
got it.
She's got it.
He's got it.
We got a winner. Yeah! Woo!
Three, 2,
1.
Okay, so now we're going to be testing the trigeminal nerve, which is cranial nerve 5. What?
Muscles of the face. Don't make it hard. Is there anything else?
Now? Okay. So now we're going to be talking about the first cranial nerve, which is the olfactory nerve. It's located above the brainstem, below the front.
on this blue balance beam. And I'm gonna have you close your eyes. Now with my... Wanna hear a joke? Sure. Why did the mushroom go to the party? I don't know. He was a fun guy. Are you ready? Okay. Are you ready?
No, but I'm gonna try.
Start stinking it up.
And last but not least, the nucleus ambiguous.
Caesar.
Yo, what's up, Brendan?
Okay. Simon says, turn to the right.
Wait.
All right.
And turn to the left.
Caesar's not snoring at all.
That.
Oh my god, he's dead!
Do we have to put the X mark?
David, I'd like you to close your eyes and to try and smile.
Wait. David, into character. Come on, in character. Alright, we've been amazing.
Okay.
Okay, ready?
Okay, everyone, we're gonna play Simon Says. Everyone, touch your toes.
You're out.
I thought it was normal.
Simon
didn't say.
Or I'll just get down.
Why
and film
suddenly
you guys.
I
won't
feel
be in it.
so hot?